Here is a detailed explanation of aspirate culture. 1. Introduction. An aspirate culture is a diagnostic laboratory test performed to detect and identify microorganisms such as bacteria, fungi, or other pathogens from a fluid sample obtained via aspiration using a needle or syringe. It is commonly used when an infection is suspected in a normally sterile area of the body, e.g., abscesses, joints, pleural, or peritoneal cavities. A2. Definition. Aspirate culture is a microbiological test that involves the collection of a fluid sample from a body cavity or lesion using a sterile needle and syringe, followed by laboratory culturing of the specimen to identify infectious agents. 3. Indications. Aspirate culture is indicated in the following cases: suspected abscess, e.g., brain, liver, lung, or soft tissue, joint infections, septic arthritis, pleural effusion, or peritoneal infection, deep-seated infections not accessible by swab, post-surgical infections, bone or spinal infections, suspected tuberculosis, especially extrapulmonary TB. 4. Used for. This test is used for diagnosing the cause of an infection, identifying the type of pathogen, bacterial, fungal, mycobacterial, determining the antibiotic susceptibility, sensitivity testing, monitoring the effectiveness of treatment, guiding targeted antimicrobial therapy. Why do need of this test? This test is needed to pinpoint the exact microorganism causing the infection, differentiate between infectious versus non-infectious inflammation, avoid unnecessary or ineffective antibiotic use, prevent complications from untreated infections, aid in managing chronic or recurrent infections. 6. What happens during the test? Procedure. 1. The patient is positioned comfortably depending on the site of aspiration. 2. The area is cleaned and sterilized. 3. A local anesthetic may be administered. 4. A sterile needle and syringe are used to aspirate fluid from the site, e.g., abscess, joint, pleural space. 5. The sample is placed into sterile containers and sent to the lab. 6. In the lab, the sample is cultured on media to allow microorganism growth. 7. Further tests like gram staining, AFB staining, fungal culture may be done. 7. How long for my results? Preliminary results. Gram stain, 24 to 48 hours. Culture results, 2 to 7 days depending on the organism. Mycobacterial or fungal cultures, up to 6 weeks. 8. Prepare for this test. Preparation guidelines include: fasting is not usually required unless guided by the physician. Inform the doctor about any allergies, especially to local anesthetics, ongoing medications, especially blood thinners, bleeding disorders. You may need to stop anticoagulants, e.g., aspirin, warfarin, before the procedure. Consent is required. 9. Risk 2. Although generally safe, potential risks include pain or discomfort at the aspiration site, bleeding, infection, damage to surrounding tissues or organs, rarely pneumothorax if aspirating near lungs. 10. Normal values. There is no organism growth in a normal, negative aspirate culture. Normal, no pathogens identified. Abnormal, growth of bacteria, fungi, or mycobacteria. 11. Interpretation of results. Positive culture indicates infection with the identified organism. Colony count and type of pathogen determine severity and treatment. Negative culture. No infection or infection with organisms not culturable in routine methods. May require additional tests like PCR or antigen testing. Contaminated sample. Growth of skin flora may indicate contamination during collection. 12. Factors affecting results. Improper sample collection. Prior antibiotic use can suppress bacterial growth. Delay in transport to lab. Inadequate sample volume. Non-culturable organisms. 13. Clinical significance. Helps diagnose serious infections in sterile body sites. Guides the use of targeted antibiotic therapy, reducing resistance. Important in immunocompromised patients, e.g., HIV, cancer. Early and accurate detection helps prevent sepsis, organ damage, or death. 14. No more. Aspirate cultures can be tailored, e.g., anaerobic, fungal, or mycobacterial, based on clinical suspicion, may be accompanied by cell count, cytology, or biochemical tests of the aspirated fluid. In imaging-guided aspiration, e.g. CT or ultrasound-guided, deeper abscesses or fluid pockets can be safely accessed. 15. Conclusion. Aspirate culture is a vital diagnostic test for identifying the cause of infections in normally sterile areas of the body. It allows for early and precise identification of pathogens, guiding effective treatment. Although minimally invasive, proper technique and timely processing are critical for accurate results. It remains a cornerstone in the diagnosis and management of localized or systemic infections. Thank you. Have a nice day.